Lagos is an emerging model megacity, the smallest state in Nigeria, but the most urbanized cosmopolitan city in West Africa. Like every state or city of its status, it has many things going for it. The people, a highly dynamic government, the economic and commercial opportunities, the city life, as well as numerous other platforms it provides for individuals and general expression. Undoubtedly, the state has a large population, and according to the United Nations estimate, Lagos state population is over 23 million. One obvious impact of this huge population is the rate of physical development across the state, especially within the metropolis. This development has grown to such an extent that it has brought different challenges across the state. These challenges, amongst which are the high maternal and mortality rates, are two major issues that call for prompt attention of the government. Maternal death. The death of a woman while pregnant in Nigeria, according to the World Health Organization, accounts for 10% of the world maternal deaths and second only to India in absolute number of maternal deaths per year. The growing HIV/AIDS pandemic, which is known to have a severe impact on women's health, is another major challenge asset because of its maternal mortality. This is addition to the risk posed to expectant mothers by malaria, which can lead to anemia, which in turn increases the risk for maternal and infant mortality and development challenges for babies.
Very important.
Lagos State, as one of the most urbanized states in the country, has an estimated maternal mortality ratio of 450 to 100,000 live births. Also, the malaria endemic, good education and unemployment will remain a challenge into the 21st century. Therefore, efforts are being made to educate women of all socio-economic groups about the immense benefits of birth control and child spacing.
Maternal mortality rate in Nigeria is very high. The ratio is 505 deaths per 100,000 live births. Lagos State government has a lot of efforts and plan. In Lagos State, there's provision of emergency obstetric drugs at all our healthcare facilities. There's provision of emergency obstetric equipment at all our health facilities. There has been upgrading of healthcare facilities to a flagship PHCs in our 57 local governments and LCDAs in Lagos State. There has been construction of maternal child health centers. We have the MCC centers, we have 7 of them in Lagos State to attend to pregnant women and the infants. In Lagos State, there's free antenatal care for all pregnant women. There's free family planning services in all our healthcare facilities, both are the primary care facilities and secondary health care facilities. Also, there is community sensitization and mobilization to inform the pregnant women where to have their delivery, especially where we have the skilled birth attendants.
So family planning is very important and people need to be enlightened. The problem we have about birth control has to do with ignorance. Many people are just ignorant about family control. If they know that they can control the rate of the children they will have, it will help them so that they can plan properly. And these children, some of them do suffer. In a situation whereby you have a salary earner that is earning maybe 50,000 in a month and decide to have maybe 5-6 children, it will be very difficult to take good care of those children. They won't have the best they need. Also, the birth control, which is part of it. People should be enlightened. The campaign should go all over, even to the private sector, not just the government hospitals alone. The private hospitals should collaborate with the government and work hand in hand, especially with the Ministry of Health, so that people can get enlightened. They can know what they can do. Many people tell you they don't know what they can do in order to control childbirth, in order to plan for their family. There are so many things they can do. They will have to do tests, carry out tests, one form of test or the other, and they will know which one is good for their own system. So enlightenment campaign should be given priority.
Family planning or birth control is very, very good. Actually it helps you to control the rates of giving birth. And it's for a woman, it helps you to maintain a happy home. You know, men, they want to go to work, come back home, they like want to have fun with their wife, and it won't be an avenue for the wife to be giving excuses. I am tired today, I am this and that. Why doing that? It might push the man outside. But when there's family plan, you know you are free, you're safe, your husband will enjoy. You won't have any reason or cause to say, I am going out. So, pregnant women, my advice to them is, number one thing is, don't give birth to the children you know you cannot take care of. You know, as we are seeing the whole economy these days, things are very, very fine. I should not say the other way around. So you should just give birth to what you know you can take care of. And the pregnant women, they should try as much as possible to take care of themselves, not just because of themselves now, but because of the babies they are carrying inside their womb, so that at least the baby will be healthy. When the baby is healthy and they give birth to the baby, they themselves will have peace. Not that running scatter, my child is this, is sick, is that. And they should always attend to their antenatal care. Go to the hospital when necessary. So that, because most of all these pregnancies, where they did not complete their antenatal, some of those hospitals, especially the government hospitals, they take them for granted. Sometimes they can even be abusing them. You don't do that because they did not do what is necessary. But when they do every necessary care that is needed, there is no cause for alarm. When they get to the hospital for their delivery, they will be attended to. It's very, very important to take care of child and children. Those children, they did not tell you they want to come to the world. You actually invited them. Take care of those children so that they also will take care of you when you are old. It's not, you can't expect a child that a mother does not take care of to take care of that woman when he or she is old. So parents should take care of their children even if you don't have much, the little you have, show love to them. If it's ordinary garri you can afford, let them understand and take it with them with love. The children, actually every one of us, what we actually wanted is love, and we should try as much as possible to be hardworking so that at least, if not to every extent, to a little extent, we can take care of them and they will be happy with us.
Family planning, one of the ways of preventing maternal and infant mortality, is available in all Lagos State General Hospitals to help individuals and couples to make their choice of the method suitable for them as well. It is also available free to the civil servants at the Folari Kuka Staff Clinic Complex at the Secretariat Alausa, Ikeja. It is available to all women with the cooperation of their spouses to adopt and tap into any family planning method proposed by certified health personnel.
If you look at the economy situation now, I think family planning is very good because it will reduce the high birth rate. And by reducing the high birth rate, each family, they will have enough planning for their children, for the future of their children. Like, as in, instead of having like 6 children, if they can have like 2 or 1, they'll be able to take very good care of them. Rather than having many children and at the end of the day, they go out of school, you see them on the street, and the ladies, they are either into prostitution, the boys, they are into touting, or do you understand? Government should find a way of, educating the pregnant women, and the pregnant women themselves, they should reduce the kind of work that they do, the stress that they pass through. Some of these pregnant women, especially the illiterates, they will not want to go to hospitals because of the expenses. They will prefer going to these alagbo, tradomedical. Sometimes it's not all these tradomedical people that have experience in doing it. Some of them, maybe they were just there when their parents were doing it. Because of the little experience that they have, they will now start treating the pregnant women.
It's encouraging because one have to, deliver few children you can be able to train. It's not wise or encouraging for somebody to start producing child where you cannot be able to cater for them. So if you can able to train 3, 2, you give birth to 2 and give them good education. For the best legacy one can give is education. The best legacy one can give to his children is education. So you give them quality education and make sure they don't suffer in life. So that is why it's good for one to encourage family planning.
This is more so as the United Nations Population Fund, the UNFPA, has estimated that maternal death will be reduced from 287,000 to 105,000 if mothers adopt modern family planning or birth control. Birth control, the prevention of pregnancy, is at the couple's discretion, and the choice of measure of control over what method they ultimately choose depends on their peculiar lifestyles. Couples intending to take a child spacing method will choose from any of 4 categories that are effective and safe. The categories include natural methods, short-acting methods, long-acting methods, and lastly, the permanent method.
Importance of birth control in family planning cannot be overemphasized. What we are experiencing today economically, we can at the same time attribute it to overpopulation. So in order to make our economy stable and in order to have good plan for our children, there is need for every family to adopt, birth control so as to provide for the family and for the children and to give them sound and good, education and upbringing. What we can do to reduce, deaths during pregnancy or during childbirth is to sensitize all the pregnant women that as soon as they have noticed that they have conceived, so they should try as much as possible to enroll themselves for antenatal so that they can have access to good, medical care. So during the pregnancy period. So I think if they can do this, it will reduce the maternal, deaths during the pregnancy or delivery. So all the pregnant women should make sure that they get access to medical care and very conversant with their doctors so that we can avoid the maternal death. Akiwumi has performed beyond expectation, and there's still room for improvement. So I will still seize this opportunity to implore our amiable governor Akiwumi to please improve free medical care for the children, and I believe that if it can sustain and improve on the present one, I believe the sky will be the beginning, not even the limits.
The United Nations Children's Fund, UNICEF, recommends that 4 elements are essential to maternal death prevention. These include prenatal care, which recommends that expectant mothers should check and monitor the health of mother and the fetus. Second is the recognition of skilled birth attendants provided with emergency backup at hospitals. While the third is guaranteed access to obstetric care to address the causes of maternal death, amongst which are hemorrhage, sepsis, unsafe abortion, hypertensive disorders, and obstructed labor.
When one is pregnant, make sure as a man who is the husband to the wife, you always advise your wife to go to antenatal. You understand me? And when she normally go to antenatal, the doctor who is more qualified will advise her on what to do so that she will take her medications all the time. But when she avoid taking all those medications, there's every tendency that maybe when she wants to give birth to that baby, she might not survive it because she didn't take adequate drugs that is prescribed for her, or even attending those antenatal to know the normal thing to do at the right time. It's good for government to give necessary education and also health, you understand me, to children, because it's very, very important. Most parents don't have money, you understand me, to take their children either to a big hospital. If government, by this administration, should encourage our hospitals by equipping them with drugs and make sure they take care of the children, I believe it will be a kudos to them. And other people in Western world will see how important it is for government, to encourage children going to the hospitals and by equipping the hospital with good drugs.
The fourth element is the postnatal care, which is the care given during the first 6 weeks following delivery, as newborns are extremely vulnerable in the immediate aftermath of birth. Hence the need for postnatal care and immunization of the infant. Unsafe abortion is also a major contributor to maternal mortality. Hence, Unsafe abortion deserves special mention in Africa, the only region where complications of abortion are one of the most common cause of maternal mortality, arising from the consequences of the low rate of the use of family planning methods in Nigeria. This results in high incidence of unplanned and unwanted pregnancies.
Abortion is something that is undesired. It shouldn't be mentioned, because I don't want to have a child. I'll prevent it. I'll try as much as possible not to have sex. I'll try as much as possible, even if I have as a married woman, to prevent having a child. But having a child, then you want to abort the pregnancy or something, is very bad. It's unfair. That's very unfair. The main thing is prevention. Just prevent it. Once you don't want to have a child, prevent it, rather than abortion. The mother can die. Even the baby is going to die. You are killing when we ought to spare lives.
On abortion is that I absolutely disagree. It is because they say prevention is better than cure. The pregnancy you don't want, there's no need for you to have it. So there are now the World Health Organization, there are various methods that they have introduced, which one can adopt to prevent, unwanted pregnancy. So I will implore the general public that they should prevent themselves. They should, but from getting unwanted pregnancy instead of having it and, going ahead with the abortion. They should rather prevent it instead of, doing the abortion.
A study reports that more than 3,000 Nigerian women being treated in hospitals for complications from unsafe abortions die each year. Abortion was the most commonly mentioned cause of death during pregnancy by respondents in that study. Similarly, pregnancies with abortive outcome were reported as a major cause of maternal mortality. Therefore, access to contraceptive methods is an important strategy in reducing maternal mortality.
We have many methods of family planning. We have the natural methods. They're in 4 groups. We have the natural methods, where we have the lactation and amenorrhea method. We have the fertility method. Then we have the short-acting method. That is the pills and the injectables. Then we have the long-acting methods, where we have the implants, and the implants are 2 types. We have the Jadel for 5 years. We have Implanon for 3 years. We have Implanon for 3 years. Then we have the IUCD that can last above 5 years. Then the permanent method, that's the last method, where we have the vasectomy for men, then the tubal ligation for the women.
In countries where induced abortions are legally restricted, women resort to backstreet abortionists or quacks. Crude methods used in the pregnancy termination, delay in seeking medical attention when and if there is a problem, and the poor quality of post-abortion care lead to a significant proportion of the victims sustaining serious injuries with life-threatening complications, resulting in either death or permanent emotional challenges. To stem the maternal and infant mortality rate, challenge of unsafe abortion, and in fulfillment of the Millennium Development Goals MDGs 4 and 5, the state is committed with absolute sense of responsibility to the sacred oaths taken by the government to protect and defend the human life. Therefore, the goal of Lagos State is to ameliorate malaria endemic, as hospitals review show that it accounts for over 60% of outpatient visit and is also equally responsible for 30% and 11% of mortality in children under 5 years and pregnant women respectively.
Malaria and HIV/AIDS contributes to maternal mortality rate and even infant mortality rate. So that is why, to prevent that, there are measures that needs to be taken. Like for the pregnant woman, she needs to sleep under ITN, that's the insecticide treated net. She should use IPT at least 2 doses in pregnancy. She must attend antenatal at least 4 times before delivery. She should access antenatal care where we have the skilled birth attendant. It could be in any level. both primary, secondary, and even the private facilities, but where we have the skilled birth attendants. And also, children should sleep under ITN 2, and they should be taken to the hospital immediately they notice any signs or symptoms of malaria in them.
In my house, we use bed nets. In fact, when the weather condition was unpalatable, to the extent that when we wake up in the morning, the beds, they are soaked, the mattresses are soaked, but we still sleep under insecticide-treated nets. So mothers should try as much as possible to allow their children to sleep under insecticide-treated nets. Many people complain the heat, the weather, this and that. Just endure it for a while, because the advantage is much more than the disadvantage. The only disadvantage is just for you to sweat overnight, but malaria will be far away from you and your family, which is very good. In fact, at times when it's around 5-6 p.m., you have to sleep under it. Once it's getting dark, they have to sleep. Go for the antenatal, take good care of themselves. You find a pregnant woman who still wants to maybe put on tight trousers. Make yourself free, make yourself comfortable. Take as much care of yourself so that the baby in your womb will have the necessary guidance and protection.
Advice to the parents out there in protecting their children against malaria is that they should try as much as possible to avoid mosquitoes where they are living, and they should make sure they should try as much as possible to maintain cleanliness, because it is dirtiness that attracts mosquitoes. They should make sure that they keep their surroundings clean and they keep their environment so that everybody, when they are living in a tidy environment, it will be very, very rare for mosquitoes to have access to their, to their houses. So they should try as much as possible to make sure that they keep their surroundings clean. And when they notice any sign of malaria, they shouldn't embark on self-medication. They should quickly go to the, qualified doctor so that they can easily cure the malaria at an initial stage.
Consequently, to tackle malaria headlong, Lagos State has instituted effective interventions such as intermittent preventive treatment and distribution of insecticide-treated bed nets. Long-lasting insecticide nets, LLINs, are being distributed to the public through the Ministry of Health to the children who have completed their immunization schedule and pregnant women who booked for antenatal care in government hospitals. Another step taken by the state through the Ministry of Health towards ensuring safe delivery is the establishment of maternal and child care centers, MCCs, in various local governments in the state. The centers are available at Ikorodu, Isolo, Ifakwa-Ijaye, Amuwo-Odofin, Ajeromi, Baja in Surulere, and Alimosho, Igodo. Others that are still under construction are located in Badagry, Ekpe, and Lekki.
The MCC, Mother and Child Center, is very helpful because I lost a son as a result of no space in the hospital for me to put that baby of 6 months old. I was told there is no bed space, and we had to stay from morning till evening time, and the child died later. But in a situation by, thank God for the mother and child, it should go round. I don't think it has gone over all the 20 local government areas. So more should be built. There is need for more. We need more so that it can go round all over. It can be at every nook and cranny of the town.
Each of these centers is a 4-story structure with capacity for 100 to 110 beds. Each has facilities for clinics, emergency services, medical records, a procedure room, family planning clinic, social welfare officer's office, laboratories and x-ray room. Other facilities and equipment available in each MCCs include slices, autoclaves, a changing room, call rooms, admission wards, a treatment room, a day room and nursery, baby cot nursery, milk rooms and nurses' rooms in furtherance of government's efforts to ensure adequate healthcare delivery and the provision of well-trained personnel to meet the needs of the people. To this end, no doubt, the fight against maternal and infant mortality is a two-way fight, which is both the government and the citizens have to be involved. Though it cannot be totally eradicated, but it is hoped that when citizens adhere to laid down instructions, the scourge can be brought to the barest minimum.